Welcome everyone to the AI Wellness Founding Cohort series. This is not a traditional medical panel. This is a live systems conversation at the intersection of regenerative dermatology, trichology, hormonal medicine, and human performance science. What we're really exploring today is simple, but foundational to the future of medicine. How do skin, hair, hormones, and systemic biology actually communicate in real clinical practice? And more importantly, how do we stop treating them as separate systems? Let me properly introduce our panelists. Dr. Jacqueline Salmons is a board-certified obstetrician and gynecologist specializing in hormonal health, endocrine balance, and sexual wellness medicine. Dr. Jessie Chung is a board-certified dermatologist specializing in skin and hair restoration and regenerative dermatologic systems. Dr. Gideon Kwok is co-owner and medical director of 7 Skin Perfect medical clinics in Southern California, co-founder of AI Wellness, and an international key opinion leader in thread lift and aesthetic regenerative procedures. Cecilia Scott is a registered nurse, BSN, founder of Contour Medical Spa and Contour Wellness, specializing in clinical aesthetics and regenerative protocol systems. I want to start very broadly. When you think about regeneration in your own field, what are you actually trying to restore first?
I always start with inflammation. If that isn't controlled, nothing else regenerates in a stable way.
For me, it's cellular responsiveness. Some patients are simply not in a biological state where they can respond yet.
I think in systems. Skin and hair are outputs. I'm always asking what the upstream driver is, vascular, immune, or hormonal.
I look at hormonal signaling first. If endocrine communication is disrupted, everything else becomes inconsistent, even the best treatments.
That's interesting, because none of you are starting in the same place, but all of you are describing the same system from different entry points. So let me ask this directly. Where do you see regenerative outcomes most commonly fail in real clinical practice?
Overtreatment. Too many interventions stacked too quickly without biological readiness.
Timing. Most protocols don't respect whether the body is actually ready to respond.
System misalignment. You can't isolate skin from hormones, stress, or metabolism.
Hormonal imbalance is often missed completely in aesthetic patients, and that leads to inconsistent outcomes.
So hormones are actually a missing layer in most aesthetic and regenerative protocols?
Yes, absolutely. In both men and women, it directly affects skin quality, healing, and treatment response.
That actually explains a lot of variability we see clinically.
This is why we've been moving toward integrated systems instead of isolated treatments.
Let's make this practical. A patient walks in with hair thinning, skin aging, and fatigue. What are you thinking in the first 60 seconds?
Inflammation status and tissue integrity.
Cellular responsiveness and prior treatment history.
System breakdown. What is dominant? Hormonal, metabolic, or inflammatory?
Hormonal signaling imbalance until proven otherwise.
So essentially, no one is treating the symptom first. You're identifying system-level causality before intervention. If we translate this into a digital avatar system, how would we simplify regeneration so it can be taught consistently across clinicians?
3 layers: system state, tissue state, and hormonal state.
And intervention timing must align with those states.
And you never treat outside biological readiness.
What I love about this conversation is that it's not about more treatment. It's about better sequencing, better alignment, and a deeper understanding of the human system as a whole. This is exactly what the founding cohort represents. Not isolated specialties, but integrated systems of human regeneration and performance medicine. Thank you all. This sets the foundation for everything that follows. To continue this experience, scan the QR code to take your interactive quiz, or connect directly with Dr. Jessie Chung's AI avatar to explore this topic further. You can also submit questions for upcoming panels through your digital cohort access. We'll see you in the next session.